Every shadow holds a story. Every story hides a haunting truth. If it chills, bewilders, or keeps you up at night, you'll find it here. Step into the darkness with us and dare to listen to the Ghost Encounters podcast. Welcome back, all you spooky people, to the Ghost Encounters podcast. I am paranormal investigator Justin Torok.
And I'm Jordan, the group scientist.
I'm Hannah, your death-obsessed bestie.
We had such a fun time with episode 1, season 4. This new video format, I think, is pretty awesome.
It is really cool.
Yeah, worst I've ever looked. But
Stop.
We look fucking good.
This is not the feel bad for Hannah hour. It's very funny to me.
Oh my god!
I'm out here flying my freaky little flag.
The freaky flag.
Yeah.
So if you want to, for those of you that are not watching on Spotify, we apologize. So the only platforms that actually allow video podcast is Spotify. If you're listening on Apple Podcasts or some of the other places, they don't really support it. So if you want to watch us, you have to watch on Spotify. And you can see us, for those of you who are not doing this on Spotify. These episodes do get uploaded to YouTube after a couple days. You can watch us there. But we want to thank all of you for listening and for all of you who are watching and seeing our wonderful faces.
Hello and welcome.
Jordan, you have something that we need to do for a special shout out to someone.
Yes.
Okay.
So what is this? What's going on?
I have a little spoopy shout out for some of my coworkers.
Am I ready?
Hannah, cue.
All right, that's my cue. Hi, Val and Lauren! Scream into the mic. And never hold a sign on the internet. I dare you to Photoshop something really sick onto this.
Oh my god.
I want you to do it. Post it on her Facebook.
She asked for it.
Yeah,
she asked for
I
it.
did.
So
She asked for it.
yeah.
There you go, Lauren. There you go, Val.
Well, thank you, ladies,
Love
for
you.
listening and watching. We love you, and
We love you.
Hannah's so excited about this. I know she is.
Yeah, I am. I'm very excited. I will shill for a small amount of attention.
As you can see, we have a new prop here today. Hannah, what do we have here?
Well, I told CJ that for my birthday what I wanted was a lobotomy pick.
Oh my fucking god.
She's always wanted one.
You.
Always.
For as
always
long as
wanted
I've
a
known
lobotomy
Hannah,
pick.
she's always wanted a lobotomy pick.
Because I've always thought deep down in the bottom of my heart that a lobotomy would fix me.
Oh my god.
That just scramble my brains a little bit.
You might change your mind after this episode.
I wrote a third of this episode, and I have not
true.
changed it. I know what this content is. I know what it is, and I'm still like, maybe this is a viable option for me. Would this do it, you guys? Would this be it?
You would
Definitely
laugh.
not. Because you know what? Listen.
Would be poof.
Yeah, and your personality is absolute gold.
Yeah.
Okay? It really is.
This is why we have fans.
It's we have Justin. It's not like you guys aren't here.
We need the comedy though. And what would we do without you?
And you bring the comedy, the unhinged comments.
Yes.
All of it.
The storylines. Can't forget about the side.
You say the things that would cause someone to get a lobotomy back in the day.
Hannah, first person to go get a lobotomy in 2024.
2024, sign me up.
Well, as you can tell from this episode, we are talking about lobotomies, and specifically Dr. Walter Freeman. So let's start with the intro. In this unsettling episode, we pick apart the chilling history of lobotomies and the questionable practices of Dr. Walter Freeman, the father of the ice pick lobotomy. Then, we slice through the hauntings of the Trans-Allegheny Lunatic Asylum, where he performed most of his procedures. Stick around and try not to lose your mind.
Ooh, that's a good intro.
That's
Love
good,
that.
that's good. All right, before we get into it, we're going to take a really, really quick break, and we'll be right back. And we are back. I think the best way to start this episode off is to have Jordan, our group scientist, to kind of discuss and go through the history of lobotomy so we can really understand what they are. And of course, we have the wonderful visual reference up here for those of you who are watching.
For at least some of the
Yes.
lobotomy, yeah. Okay, so back in the 1940s, the brain wasn't clearly understood. They understood the anatomy from performing autopsies and understanding personal behaviors. There were no imaging studies like we have today, and the ability to understand brain chemistry was not yet realized. So they basically didn't know what the fuck they were doing.
Well,
Let's just say it how it is.
Makes sense.
They had no idea what the fuck they were doing. They did what they could do at the time, though, which was treat the symptoms, not specifically the mental illness. Medications weren't created yet. This was the dawn of mental illness. Let's just say that. Before the inventions of lobotomies, there were harsher treatments such as chemical injections, insulin therapy, and electroshock therapy.
Ugh.
The chemical injections were to try to target specifically the brain. In the 30s and 40s, they used sodium amytal, which is a barbiturate, that slows down the nervous system. Today we have amobarbital. I thought that was pretty fancy of a word.
It is. I don't know what that is. It is, okay.
We'll get to it.
I was in some guy's house the other day, and he had a bunch of, like, photos of Marilyn Monroe, like photos and art of Marilyn Monroe.
Yeah.
And he's like, oh yeah, don't mix barbiturates and alcohol, or you go out
right,
like Marilyn.
right. Yeah.
And I was like, oh, is that how she died?
That is.
Yeah, that is.
Like I'm just tell me words, man.
Yeah, and we'll get that. So it was used to specifically reverse catatonic states of patients with schizophrenia. So catatonic, we know they like become very rigid. They have limited dialogue, if any dialogue. So basically they would normalize, I'm using air quotes, people can't see that
Yes.
I'm doing that, normalize the patient, making them seem quote unquote better. Air quotes again.
Just in case anyone gets upset, these are words that they used.
Yes.
These are not words that we're using.
Yeah, hell no.
It's just words that they used.
Like obviously it's
better
uncool.
describe what it was that they were trying to do
Yeah.
back in that time.
The
obviously.
30s and
Yes.
the 40s.
Yes.
Not
I don't want anyone to get upset.
2024.
It's not like we think they're not normal. It's just
Yeah.
the terms that they used.
Yeah.
Yeah, like obviously nobody wants to be fucking doped out of their mind.
Exactly.
Yeah, absolutely,
Yeah.
which is what they did to these poor people.
Yeah.
So, a con to this treatment was that it's a highly dependable drug, and it's also super addictive with extreme risks of overdose. Insulin therapy, which I can't even believe, like this is crazy. Insulin therapy was when patients were injected or they and if you look up videos or pictures, which yes, I did. Because I wanted to see exactly what was going on. I even looked up lobotomies, everything.
Mm-hmm.
So they held this like fucking funnel, and they would basically, in the one situation, put it like into their nose.
Jeez.
And just this nurse is holding this freaking, it looks like as if you were at a frat party and they did a chug, but instead this kid or whoever it was would be laying in this bed completely like comatose,
Just
because that's
zonked.
what you basically over pumped your body with insulin, putting yourself in a coma for days.
So the barbiturates would kind of pick you back up, but the insulin thing would
Knock
your
you
ass
out, yeah.
Okay, so
Gotcha.
So in some cases, patients were injected with large doses of insulin, putting them into comas. Like I said, seizures occurred before and after or during the coma. Patients would be tossing, rolling, moaning, twitching, spasming, or thrashing around. And like some of these people were young. Like some of them were kids that like
Yeah.
parents were like, hey, I don't know what to do with this kid, and would take him, and they would put them through this shit. An issue with this treatment is hypoglycemia, which is low glucose or blood sugar, causing patients to become extremely restless, sweaty, or liable to further convulsions. Electroshock therapy or electroconvulsive therapy, which we still use today,
Really?
Yeah.
we use electroconvulsive therapy today as a last case resort.
yeah, it's not something like fun that people
Yeah.
typically choose to have done.
Fun is not the word I would use.
Yeah.
No.
So it involves electrically inducing a seizure to disrupt brain activity, which is crazy because eventually when we get down to like lobotomies, they're still using this first before they would do
Yeah.
the lobotomy,
Right,
which is
right.
crazy. It was terrible for people back in the day because they didn't use muscle relaxers like they do today. So as a result of the harsh treatment, the body on the body without helpful drugs, full-on convulsions led to bone fractures and dislocations. I did some reading
Oh my
that
God.
specifically the dislocations were from like the jaw and like ribs breaking and stuff like that. Yeah,
Jeez.
so
That tracks.
pretty
Yeah.
harsh. Like imagine you just got done with a seizure and then you wake up and your ribs are fucking broken. Like,
Yeah.
or your jaw is dislocated and they have to pop that shit back in. That if for like a kid, that's
Or
horrible.
in CJ's case, your
my
earring got ripped out, and
Yeah, my partner has epilepsy, and we tell this fun and interesting story about the first. He had a couple on camera, and the one that he had when he was probably like maybe this wasn't the one he had when he was 14. He was really young, and he had one, and he had an eyebrow ring at the time, and he ripped
That's
out
what
his
it was,
eyebrow.
eyebrow
Yeah, he
ring.
ripped out his
Holy shit.
eyebrow ring on the carpet because you can't like. There's nothing you can do. You have Elvis has left the building. You're fucking thrashing.
Yeah.
You're on the floor. Chaos. It is
Yeah.
chaos.
Yeah. I'm fortunate to never have to like see something like that. I saw a doggy one once, but
Yeah.
that was enough for
yeah,
me. That was all
I saw a dog one once.
that
too.
was all I could handle. I couldn't imagine seeing somebody that I love, go through that.
I've seen it 8 times.
Oh my fucking god, Hannah.
Like.
Okay, so
All right, let's go.
Yeah, no, I'm not here to be weird about it. I'm not, like it's weird when the weirdest thing that's happened to you is like kind of happening by proxy.
Yeah.
Something else.
So these treatments rarely killed patients, but left some with brain damage and seizures for the rest of their lives. Before the first lobotomy, doctors were rarely manipulating the brain to change behavior. Beginning in the late 1880s, a Swiss physician, his name, I'm not even going to try to pronounce, I'm just
Don't.
going to call him Burkhardt,
Yep.
removed parts of the brain's cortex in patients with manic agitation, auditory hallucinations, and symptoms of schizophrenia. He discussed in his research that the surgery calmed his patients, though some suffered from complications, which,
Obviously.
yeah, it's going to happen.
Some of them suffered from brain damage.
Yeah, such as motor weakness, sensory aphasia, which is the inability to understand speech, writing, or tactile symbols,
Oh,
and
wow.
epilepsy.
Would that count as? Because I might be wrong. I am not a doctor.
Neither am
I
I.
feel like my conception of epilepsy is a bunch of fucking seizures that you don't know why you have them. But I feel like in this case, you kind of, well, I don't know, maybe that's not necessarily the case. Maybe I'm wrong. But in this case, it's like epilepsy, you know what caused it? It's because somebody fucking stuck a bunch of metal shit in your brain. Like,
Yeah.
I don't know.
I think at this point in this research, they're talking about like people that are born with epilepsy. Like
Okay,
people, they're
fair.
trying to
That's fair.
figure out how to treat those people. They haven't caused the epilepsy yet.
Yeah, no,
But
yeah.
we'll get to that.
Oops, all epilepsy.
Also, one patient died 5 days after this procedure. Moving on, a Portuguese neurologist, Antonio Moniz, created the first lobotomy in 1935. So he started these procedures, and then these guys at Yale, let me just say it that way because my sentence makes no fucking sense. John Fulton and his colleague Carlisle Jacobson performed basically a lobotomy on a chimpanzee. They took out the frontal cortex of this one chimpanzee. She apparently showed signs of agitation. I think her name was Lucy. There was another one named Becky, but I don't know exactly which one they did this on. They took apart literally the brain out.
Jeez.
Ooh.
So the brain was out, and she showed signs of being calm, obviously, because she didn't even know why the fuck she was probably there. So they did that because the frontal lobe basically is your personality. It's all your cognitive abilities, like, and understanding how, like, why you do something. Like, Justin, why did you just scratch your face? That is what your brain, that's what your frontal lobe is doing.
Interesting.
Like decision
That's really
making.
Yeah,
interesting.
decision making.
Wow.
Yeah. So, and like, she showed frustrations as if, like, when she was doing a puzzle and the puzzle didn't fit, she would, like, cause a little chimpanzee tantrum. And they were like, okay, we gotta fix that shit. That's not normal. I also think
I feel
it's
like it's
really
normal
interesting.
for a chimpanzee, but
Yeah. I also think it's pretty interesting that they chose 2 female chimpanzees.
Hmm.
Yeah, instead of a male chimpanzee. We'll get to that
Yeah.
too. Later that year, Moniz and his colleague, I can't pronounce his name, not going to try, we'll just call him his colleague, performed the first human lobotomy experiments on people. They operated on 20 people. I heard that it's like a range of 20 to 40 people. They targeted the patient's frontal lobes because that brain region is associated with behavior and personality. Let's all think about Phineas Gage, that guy had a fucking whole ass piece of metal shoved into his face.
Right.
And he became like agitated and aggressive, probably because he didn't understand some cognitive abilities.
I just feel like it would be so frustrating to remember how you were and how you were able to behave and function, and then just not be able to do it anymore.
Yeah, exactly.
Definitely.
So they then reported the surgeries as a success in treating patients with conditions such as depression, schizophrenia, panic disorder, and mania. But the operations had severe side effects, including increased body temperature, vomiting, bladder and bowel issues, meaning like they can't control their bladder or their bowels, eye problems, lethargy, and abnormal sensations of hunger. Like people gained like 70 pounds after like one of these surgeries, and among other issues. The medical community was divided and super critical of the idea of using this on patients, especially patients that sometimes weren't able to say, no, I don't want that fucking lobotomy done. But physicians started, they heard about this, they went to this like convention, and these guys were like, yeah, this is what the fuck we're doing. And basically some of these people were like, wow, I can't believe you just did that on a person. And other people were like, whoa, let's do it. And then they like kind of rolled with it. They started using it around the world. So let's get to lobotomies. Lobotomy, which is also known as a leucotomy, you may hear me say that a couple times today, is a neurosurgical operation that involves permanently damaging parts of the brain's prefrontal lobe. They were first introduced in the mid-20th century and have always been super controversial, but were widely performed for more than 2 decades as treatment for schizophrenia, manic depression, bipolar disorder, and among a shit ton of other mental illnesses. Unfortunately.
Yeah.
The behaviors, in quotes, doctors were trying to fix were thought to be from neurological connections. So the idea was that if you stop or damage these connections, you could stop these bad, quote, behaviors. Sometimes people would go to do these lobotomies just because they didn't fucking do the dishes right. And their husbands would be like,
oh yeah, of course. That happened to women a lot.
Gotta go drop her off. She's not the right wife for me, you know.
Yikes.
The lobotomy was invented during a time when people didn't have many options on how to treat mental illness. I want to stress that a lot because I was listening and I was doing a lot of research, and I think people were extremely harsh on this portion of lobotomy history. I think we need to stress that they didn't have that many options, people. They thought that this was the breakthrough miracle that was going to fix somebody from being so depressed that they can't get out of bed.
Yeah. I think that it's not necessarily fair to demonize people who thought they were helping.
But when we talk about Freeman, we can demonize his ass. He's crazy. So, like, my thing is like, why spend the rest of your life institutionalized when this happened and you're like, holy shit, I can walk out of getting my lobotomy done that day. Mm-hmm. I can go home to my husband, or I can go home and whatever, or I don't have to be stuck in this asylum just because I have depression or just because I have schizophrenia. I'll stop seeing hallucinations.
Because you didn't want to be in one of those fucking places.
Like
it's all bad.
Most of the time they had so many freaking people in these asylums that they couldn't even deal with them.
Way too many, and I'm going to get to that later on.
Oh,
but
yeah.
Way too many.
And
for dumb reasons.
We did that episode on old-timey mental institutions.
Yeah.
And there was one story that I think I might have researched it, but it was in a place that was so overcrowded that some woman was murdered, and they only knew because a bunch of patients were carrying around her teeth.
Yeah.
Oh, yeah.
Way overcrowded.
Yeah, shit was fucked.
Some of these people weren't even meant to be in asylums. They were just trying to fix. They just wanted them to conform to the norm. Like if somebody was rebellious, they're like, "Fuck you, you're going into this asylum, and they're gonna fix your ass." But in reality, it was just a terrible living situation. It was horrible on those people. But moving on, there are 2 types of lobotomies, which I didn't know about until I did research. There are prefrontal and transorbital. which differ in how the brain is accessed. So prefrontal lobotomies is when a surgeon drills holes in the skull to access the frontal lobes. Transorbital lobotomy is when a surgeon inserts a tool through the eye sockets to access the brain. And yes, I did look up a lobotomy on how they use that bad boy.
Yeah.
I was telling Val at work, I was like, I am shocked. I cannot believe that is how they did it, because sometimes, like, when we get to it, like, obviously Hannah's probably gonna say it, Freeman was not a sterile person. Like, he literally didn't even wear gloves or a mask when he did surgeries in his office, by the way.
Well, he did so many, and we're gonna get to that,
that
it was just like second nature to him.
So now this next part is, I'm gonna get super technical. I'm gonna try to explain basically what they were doing when they went in there and mushed your shit around. So, because that was what I was like reading, and I'm like, when are they gonna tell me what they're doing in there?
Right.
Like, sure, you can poke a hole in their brain, but what are you doing? I need to understand that aspect. Oh, and best believe I did. I got to the bottom of this shit.
Jordan is basically certified to perform my lobotomy.
I was like, I remember.
We can do it here.
I mean, we have the tools. She knows what. No,
everything off the table. Everything off the table. It's time to rock.
Getting real weird with it tonight.
We are. Stop. We're not doing that. We need Hannah to be how she is. Okay. So the cerebrum, which is your goddamn head, consists of two cerebral hemispheres. The outer layer is called the cortex, which is the gray matter, and the inner layer is white matter. Gray matter is located mostly on the surface of the brain and is made up of neuron cell bodies, dendrites, and axon terminals. It allows people to control movement, memory, and emotions. White matter is located deeper in the brain and is made up of nerve fibers like axons, and they're covered in myelin. So myelin is like, it has a protective sheath and it's able to, like, you know, send signals super fast and they're protected and blah, 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 blah. Myelin gives white matter its color. Let me flip. White matter connects different regions of the brain that helps the body process information. So then when a lobotomy is done, basically it severs the white matter between the areas of the gray matter to basically stop brain transmissions in a certain area.
Oh, fuck.
Yeah. Now, the procedure for prefrontal lobotomy is, like I said before, 2 holes are drilled into the patient's head, like ding, ding.
Right by the temple.
Right on the
Really small holes.
Yeah, nobody can see what I'm doing, but you hear what I'm doing.
I hear what your sound effect. I'm laughing at your sound effect.
And then at this point in lobotomy history, they would inject pure ethyl alcohol into the prefrontal cortex. I have a quote from an actual neurosurgeon. Alcohol was basically used to disrupt the neuronal tracts that were believed to give rise and reinforce the recurrent patterns thought to be observed in mentally ill patients. The Portuguese doctor made a specific instrument called a leucotome. See me, I use a microtome at work, so when I saw leucotome, I was like, ooh, what's it gonna have? It's gonna have something sharp. It's gonna be freaking scary. And it is. You should probably look it up. You know those motherfuckers that you use to, like, clean your drains? Yeah, imagine that as like a rod, and it goes into your fucking head with a little, like, loop.
And they just, like, they pull out, like, a little biopsy.
They would go, so this loop, after he would, you know, roto, whatever the fuck it's really called, into your head.
Root your brain.
So when it would go into your brain, there's this little loop, kind of like a dog, like a slip leash. It would go in.
Like that shit that Steve Irwin used to use to catch snakes.
Yeah. So it would go in and it would do, like, he would move it around and it would, you know, detach and disrupt what it needed to do in your brain, and they would pull back out. Just like that. And then they go to the other side, do the whole thing.
Do it again.
Just like
Your
that.
sound effect.
It's crazy. Like, I just think it's insane. Like, this was a big deal. Like, this guy won a Nobel Peace Prize for this, for creating a leucotome and creating leucotomy, basically.
I have more on that later.
Yeah.
I have more on that. There's receipts for that later.
Ooh.
And also, I just want to say, if you look up Moniz, what is his name? Antonio Moniz. He looks exactly like you would think a guy that would do lobotomy would look.
So does Freeman.
Like,
yeah, Freeman does.
if you look up a picture of him, he don't even look like a real person. Like, he's like, his just like in these black and white pictures, his skin's smooth, but his ears are all janky, and he just looks at you like you're already dead to him.
Oh my god.
Like they're like he's a freaky looking dude.
He's got the devil behind them eyes.
Yeah, it's pretty crazy.
There's no empathy.
Yeah.
Only,
So
I don't know.
this type of lobotomy with the alcohol injecting was modified so that they just cut into the patient's head and use like that little thing, mush it around and pull stuff out, and called it a success, basically. Like I said, they modified it and took out the alcohol because sometimes the alcohol would spread to other parts of the brain without their control.
Well, yeah, obviously.
Yeah, like, I mean, it's a liquid. What else is it going to do? It's going to seep in there and go in all the crevices and fuck up whatever they're doing worse. So that's when they decided, okay, we're going to use this Lobotomy. It's quick, it's easier, there's less issues, blah, blah, blah. An Italian psychiatrist, I don't know how to say his name, Fiamberti, developed a procedure that involved accessing the frontal lobes through the eye sockets, and that procedure would inspire Walter Freeman.
Of course.
The devil himself.
Our favorite charismatic villain of the story.
Yes. And just like that, we're going to move on to the next type of lobotomy, transorbital lobotomies. It was created by Walter Freeman, in which a pick-like instrument was forced through the back of the eye sockets to pierce the thin bone, because the thinnest part in your skull is in the back of your orbits. And it's the best way to get to your brain. Just in case you want to poke somebody's eye out.
It's easy to fucking punch through with a sharp.
Well, what if you're being attacked? It's a good survival skill. Okay?
True.
Go for the eyeballs first.
Yeah, so they'll pierce the thin bone that separates the eye sockets from the frontal lobes. I watched in this video, he's just like, hey, how are you? Okay. And then he shocks the shit out of these people, and he literally takes his hand, lifts their goddamn eyelid up, and takes that motherfucking thing, and he literally would like sink real slow back into your fucking face. Tink, tink, like with a hammer. Just like that. But his hammer was pretty scary looking. I just used random shit. But
there's a hammer in the box. Too.
Yeah, there is.
I don't know if you can see the hammer in the box.
If you want to watch one that looks pretty real, if any of you have watched the TV show The Boys on Prime, the superhero who's super smart, she likes giving herself lobotomies so that she can go from super smart to like kind of dumb, a little bit below normal, and she has the Deep help her with that, and he gives her a lobotomy, and you literally hear him crunch through the bone and scrape, and it's just
like they describe it.
It's wild. Yeah,
I might have watched that with you.
I showed you that, and you were delighted.
I was.
Yeah, there was a source that said it kind of sounds like archaeology. Like when they're like kind of trying to tap away stone to get to like their bones that they're looking for and stuff like that. But yeah, that's how it sounded to some people.
Now they're going through your bones to get to your squishy bits.
Yeah. So the PICS point was then inserted into the frontal lobe, and it was used to sever connections fibers basically in the brain, presumably between the prefrontal cortex and the thalamus. He's like, okay, let's lift up this eyelid. Like I said, put a nicely chilled, like he would literally chill his ice picks, Freeman. We'll get to that. Like I'm assuming that's probably something that Hannah's going to talk about.
I did absolutely not find any of that.
He literally would freeze his ice picks and like, well, because at one point he went home and he was like, oh, I'm having such a tough time not getting my needles to break into my fucking patient's eyeballs. Now you have to put him through surgery to get the fucking metal out. So I'm going to, go home and fucking chip up some ice. Oh, shit. This'll work, and took it to work.
My dude.
And was like, yeah, this is what the fuck I'm gonna use. I'm gonna use this nice spear shit, and it's gonna be perfect. It's not gonna bend, it's not gonna break. This is what I'm gonna use. And literally, you can see pictures of it. It's a fucking nice.
Yeah, it's just a regular ice pick.
I have an ice pick at home that I use.
I mean, before he invented, or whoever invented the actual pick, they had to use something.
Because when I use, my ice gets stuck together, so I use my ice pick to kind of, break it apart. And I'm like, holy shit, I went home last night and I looked at my older sister and I was like, this is what this motherfucker used in these people's heads.
Like this galaxy brain moment, everything aligns and it's all terrible.
So he would go in there and he would be the one to like kind of scramble it around. Like he would take this and he would move it like vertical, horizontal, and a nurse actually explained that because eventually he went on fucking lobotomy mobile and started doing this for people all over the place under a fucking tent probably, and this woman was like, I literally was repulsed when I heard it. It sounded like tearing cloth when he would move.
That's what I would imagine it would sound
when he would move
like.
that piece around. I mean, I don't want to say it. I heard we had to dissect a goose. Well, this guy did. He was like a professional. I was just standing there. And he like ripped the stomach out of a goose and it made a sound I will never forget. And that's kind of how I imagined it.
Yeah.
Like had the sound being, because you have to rip everything's being held together. It's not like it's just free floating in your body.
Yeah,
You
right.
got, like, tendons,
So, yeah,
you got connective tissue, and like you're, like once in a while, I'm like, I cook, but I'm not like a super fan of dealing with raw chicken or like butterflying chicken, because in my head I am very unpleasantly reminded that humans are also made of meat.
Yeah.
And then I ache myself out a little bit.
Yeah.
So it happens.
Well, what
Yeah.
makes me super sick to my stomach is to know that before these people would go for these transorbital lobotomies, before they found out that it's so quick that they don't even have to knock them out, they would do the electroshock therapy to make them unconscious to be able to do. Like, that's crazy. Like, you put them through that to knock them out. Then you put them through, they won't feel it, probably won't even remember it when they wake up. And then their eyes, there's pictures if you look it up online. I have a link that I sent you that has good pictures. It looked like they just got battered and beat. Like, their eyes were black and blue, and and they're sitting there smiling after their procedure, like, he helped me.
Maybe.
Yeah, okay.
We hope so.
So thank goodness for the creation of medications later in life, because damn, I would not be able to sit through that.
Yeah, no.
No. It's all bad.
He also didn't really give a shit about, like, people. Like, he kind of thought of them as, like, just research opportunities. And like I said, he didn't care about being sterile. He didn't use a glove. He didn't use a mask when he did lobotomies, which he shouldn't have ever been allowed to do lobotomies. Let's just say that right out
not
front.
at all.
Also, like, I mean, I go over, because my portion was talking about Freeman.
Yeah, which I'm about to stop talking about him right now.
But,
right now, that's it. That's all I got on him.
Okay, but the man was not actually qualified to perform surgery.
Yeah, I have a side note here that says, before we move on and talk about more scary shit, I just want to stress the importance of the difference between a neurologist and a neurosurgeon. Neurologist, let me just say it. Let me get into this real quick.
You're passionate about this. I know you are.
Yes, I'm ready to rumble. So, neurologists, they're basically used to locate the issue. They locate the tumor, or they locate, like, where in the brain something could be wrong, why you have something going on in there. And
like diagnostic.
they give the information to the neurosurgeon. The neurosurgeon is the one that opens you up. They are the one that can operate legally, and they're the ones that pull your tumor out or whatever else is wrong with your brain. That's the best way I can explain it.
Yeah, and I'm kind of really happy that in today's society we have those rules, we have those set expectations for those set positions, instead of just, some medical professional willy-nilly scraping at someone's fucking brain.
Yeah, and they still do lobotomies today. They're different kinds. It's obviously not a fucking ice pick through your head. They'll literally put you through surgery, because there's, in certain situations, like, drugs don't help them. Like, medications won't help them.
Yeah.
So they find out, they're like, okay, I think there's a form of epilepsy that it literally in the name says, like,
It's like
no drug.
resistant.
Yeah, like drug resistant. Yeah.
Wow.
And they, in that form, if people are struggling that bad where they're having, like, seizures every freaking 20 minutes, they may take out a part of their brain.
But now people have an option.
Because that's your last option, people. Not the beginning.
But at least they have an option.
Yeah.
Because back then, some of them didn't really have
They
an option.
didn't.
And also, if somebody has epilepsy, a lobotomy is not the only kind of neurosurgery that can be used to treat epilepsy.
Yeah.
There are plenty of different things.
Absolutely.
So if anybody has
Don't get scared.
epilepsy, don't get scared.
Don't get scared. My fiance's dad has epilepsy. He's on medication.
Yeah, and CJ has epilepsy.
He hasn't had-
He's on medication.
Yeah.
Is so far so good.
Yeah, fingers crossed. I know that they use it on OCD patients too, like people that are like
Really,
like chronic OCD, where like
Yeah,
they're
like,
okay, these people are counting their steps, they're reversing, rewinding, and they're doing,
like it's become very disruptive to their life.
Yes,
Right, okay,
like
yeah,
where
yeah.
they physically cannot cope in life, sometimes they will put them through surgery as well. But I just want to throw out some statistics before we move on. In 1951, a study said that nearly 60% of American lobotomy patients were women, and limited data showed that 64% of lobotomies in Ontario from 1948 to 1952 were performed on female patients. So that's more than half of the people that were coming in to get the brain mushed.
Yeah, and there's a reason for that. It's because of
Yep.
the time.
Yep.
Unfortunately.
It's
Yep.
misogyny.
Yeah.
Yep. I had to also add this. Also, apparently about 40% of Freeman's cases were gay men.
Yeah, that makes
Because
sense.
you weren't allowed
Yeah,
to
it
be
does.
gay.
No, you weren't allowed to be.
That's
Not allowed.
So, basically, all three of us would have been lobotomized for some kind of reason.
I would have been
that's true.
lobotomized for rebelling. Let's
Me-
get real.
yeah.
I would have been,
Would have been lobotomized for being a gay man, and you have been lobotomized for
being funny.
Any number.
a lot of
of
things.
just being
Any number.
dry
of things.
humor. Just anything. So lastly, so that's all I have. I'm going to stop myself there. I feel like Hannah's going to tear it up with Walter Freeman, so I didn't really put a lot in. But I just want to say this because as I was listening to things, like I said before, I felt like people were very harsh on just the people that created lobotomies before Freeman.
Right.
So the last lobotomy he did was in 1967, but we put it in our minds how inhumane and horrible the thought of lobotomies are. But look at the time when it was done in. For me, I can't fully make these people out to be monstrous and terrible when we take a close look at something that's also super harsh, like chemotherapy. Now, I don't mean to be insensitive, I'm just throwing this around as a good example. Hear me out. Stick with me. It's horrible for a person to go through chemotherapy. It can give patients lifelong bad side effects and permanent damage. But that's their only option. Like that's where I'm going with this. Chemotherapy is the only option we have for cancer if it's really aggressive.
When it's you or the cancer.
Now think about
I
it.
don't think anybody
That's
would
what-
blame anyone for
Yeah,
that,
that's all
you
we
know?
have right now.
And who knows? In
That's all we
40
got.
years, people might look back and think, "Oh my God, chemo is the worst thing they could have done for these
Exactly.
people."
That's my exact point I
You know?
have written on my paper.
I just think it becomes dangerous. It becomes
Yep.
you monsterize these people, and they do it to people that shouldn't have had it. Like women who
That's
just
the issue.
weren't the
Yeah.
norm back then of being the perfect stay-at-home wife, or gay men, or people who had minor issues. That's when
it's monstrous and horrible.
Or when
But-
someone like Freeman, who does the amount that he did,
Yeah.
and we'll get to that later.
Yeah, with
There's
just
people-
the lack of care.
But there were people that were begging for lobotomies because
There
they
were,
wanted the
yeah.
the hallucinations to stop. They wanted the depression. They wanted the agitation. They wanted all that to go away. Just like when you have aggressive cancer, you just want that shit to go away.
yeah,
you just want to
people
live.
just want to live a good
Yep.
life, you know.
Yep. So how can we say that when a cancer fucking miracle happens, how can we say, like, oh, that was so inhumane what we put those people through 25 years ago or 50 years ago? We'll be in the exact same position that we are today talking about lobotomies.
It's the time of science, right? Back then
Yep.
we didn't have the science that we do now. So when we look back, it looks really bad, but at the time it was the option.
I just
But
wanted to throw it in, just a
It's
quick
still-
little
Yeah.
discussion.
it's still an awful procedure.
Fuck yeah.
Not
And
to,
it's still-
But Walter
should not-
Freeman can fuck off.
Yes, he
he's,
can.
he's a piece of shit. Like,
And
let's
it
get
still
real. That's
should
not who I'm
have
talking
been
about.
done to probably 95% of people that it was done to.
Yeah,
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 you
know?
absolutely.
So that's why it's really freaking crazy. All right, so we're gonna stop there. We're gonna take another short break, and then Hannah's gonna get into Walter Freeman himself.
I'm so
And we're
excited.
gonna hear
Oh, no.
from the monster, from the father of the ice pick lobotomy. Stay tuned. And we are back. Hannah, let's get into the crazy man himself, Dr. Walter Freeman.
All right. I did all my research and I was just like screaming internally the whole time because the concept of a lobotomy is kind of like induce a traumatic brain injury and fucking see how it goes.
Yeah, you're not wrong.
Yeah.
No, and in the last mental health related episode that we did was like a huge fucking bummer, and I had to go drink myself into unconsciousness afterwards. So I hope this is like less of a fucking
Oh my god,
slog.
the asylum
the
episode.
asylum episode
I
last
was
season.
messed up
That was
after
bad.
that.
Just the sheer weight.
My
of,
dad even texted me. He was like, "Hey, that episode was messed up," and I was like, "Yeah, I was shot at the end of that. I barely even wanted to do my bit. If anybody noticed, you're absolutely correct. I did not want to do
Yeah,
my
I'm
bit.
glad we were not on
Yeah.
video for that one.
Yeah, I would have been.
It was bad.
It was very depressing.
We all felt bad.
Yeah, I would have been looking out lost. I just was a mess that day.
Yeah.
Yes. Thanks a lot, Walter Freeman.
You piece of shit. Let me specify
Yeah.
that again.
That's he's the big guy, TM, that we think of when we think of lobotomy.
Trademark.
He was born Walter Jackson Freeman II, and he's a Philadelphia guy. He's from PA. Unfortunately.
I saw that, yeah.
Yeah, he's from PA.
Yeah, he
Well,
studied
sorry.
at like Pennsylvania.
We had a shitty person come out of PA.
yeah.
Sorry,
medicine,
everybody.
yeah.
He went to Yale. He
Yep.
went to medical school at fucking UPenn.
Yep.
He was he started out very qualified. He actually came from a long line, but a line of well-known doctors, with one of his great-grandfathers or grandfathers.
His grandfather,
being,
yeah.
Yeah, a doctor during
What
the
was
Civil
his name?
War.
William Williams. Keen.
Yeah, I only
Great
remember William Williams because of the fucking Poe story.
That's the most ridiculous thing I've ever heard, but whatever.
But Walter
He-
Jackson, what?
He, just a side note, William Williams himself, he was the first person to successfully perform the removal of a brain tumor.
Oh, shit.
He was
There
a big
you go.
deal.
Wow.
Okay, but keep going,
So
sorry.
I'm sure
Let me
there
shut
were.
the fuck up.
No, you're good. That's interesting. I didn't uncover that information. But I'm sure there were like some like weird things that he felt he had to live up to.
Yes.
Oh, absolutely.
Big shoes to fill.
Absolutely.
And that's
Yeah.
his villain origin.
I don't
That is
understand.
his villain origin.
But like,
Like, I
why
gotta
didn't he go into neurosurgery? Do we know why? I didn't
I
figure
don't
out
know.
why.
You know,
Yeah.
he kind of did go into neurosurgery. He just like did it wrong.
Yeah.
He took the shortcut, and like
Yeah.
2,500 people suffered.
Yep.
Not to
There-
mention like the fallout for anyway.
Yeah.
Born in Philly, American physician, neurologist, and psychosurgery pioneer. And he also had a son who went into
Oh, cool.
being a doctor. His son was actually like pretty normal, lived a normal life, had a thriving practice connected to UC Berkeley. But like, can you imagine?
Like, yeah, my dad's that crazy asshole
Yeah.
that died still thinking
Yeah.
lobotomies helped people.
Fucking disgraceful.
Very.
Fucking disgraceful.
Despite being known for the lobotomy, Freeman did not invent the lobotomy. We talked a little bit, Jordan talked about Gottlieb Burckhardt and Moritz. I have his name as something different, so I was probably wrong. But Moritz, who I'm going to be referring to only by his last name.
That's his middle name, I think.
it?
Yeah, that Egos
Yes,
or
I
whatever.
don't know.
Yeah, I think that's his middle name.
I don't know anything about
Regardless,
Portugal or
he's
Portuguese.
freaky looking. I definitely recommend looking it up. It scares the shit out of me every time.
But that freaky looking man was Freeman's mentor.
Yep.
So, and Freeman was like obsessed with him.
That was the worst day in like medical like neuroscience to ever happen was when those two fuckers met. Yep.
Yeah.
Partnership made in hell.
Yep.
So the procedure was already something that was done to people, but it's kind of after watching a bunch of them and really kind of drinking the lobotomy Kool-Aid, Freeman decided he could do better, in that he could do much worse.
He thought he could do better.
He thought he could do better. This,
Unfortunately.
the hubris of this man led us to the transorbital lobotomy, similar to a regular lobotomy, except they stick an orbitoclast into your brain and just scramble your shit. This was initially a major surgery under very controlled conditions.
Yes.
Sanitation occurred. People washed their hands.
You'd hope.
Because
You would hope.
he wasn't doing them by himself at first. He had that guy, what is his name? John Watts, something Watts.
Yeah, he used to, initially he worked with an actual neurosurgeon
Yeah.
who was performing actual lobotomies. But then when Freeman kind of lost his shit and invented a transorbital lobotomy, his partner was so disgusted that he dissolved their partnership.
Yeah, he walked
Yeah,
in
I
and he
mean-
was like, skirt, I'm leaving. That's
Holy
wrong.
shit, man.
Yeah, he walked out straight up.
Yep,
What
dissolved
the fuck
their
you doing?
partnership.
Because he walked into his fucking shared office with the guy, and the guy had picks sticking out of somebody's face.
Nobody wanted that except for you.
No.
Um,
Exactly.
Nobody wanted that shit.
And which, I was going to say this when you were talking about the leucotomy.
Oh, you should have. Cut me off.
I got scared. But when
Why'd you get scared?
I don't know. When I was maybe 15, I read The Bell Jar, which, that'll surprise nobody. If you read The Bell Jar, you know why I read The Bell Jar.
I'd never read The Bell Jar.
Would I recommend The Bell Jar? Probably not. Especially if you're reading it and you're maybe a little bit fragile. Because when I was 15, I read it in high school and I was a little bit fragile and I probably shouldn't have been reading it. But the main character, Esther, is 19 and she ends up having this prolonged depressive episode.
Aw.
And ends up in 1950s mental hospital where she encounters this other girl who is doing great and is like, oh yeah, I had a lobotomy. And the girl, Esther describes looking at this other girl who has these two little scars at the tips of her head. I know Jordan said it was at the temples, so maybe Sylvia Plath was wrong, I don't know.
I mean, they probably poked it wherever the fuck they wanted to poke and just started doing
Yeah,
what they wanted.
who
I don't
knows?
think it matters. I think it's just because there's a nice, right at your temple, there's a nice slip there.
The
that
bones
I
are thin.
I think that mattered, but who
But
the
who
fuck
knows? They could have
I could be
went
wrong.
through anywhere.
I just
Yeah.
know I watched a video and the guy went to the side of the head. That's about what I'm not educated on the lobotomy that much.
Yeah, me neither.
I did my personal research.
But yeah, her name was Valerie. She was doing great, except forever she would look like she had little devil horns removed. And I was very confused by that because at the time I only knew about a transorbital lobotomy, and I was like, why the fuck would she have scars? How do you get through
Yeah,
that?
right.
I don't know. I'm 15 and I don't know anything. Did anybody, okay, and we were talking about housewives as well
Yeah.
with the lobotomies. Does anybody else remember in American Horror Story where Franca Potente gets the lobotomy? Do you remember?
Ooh, I'm going to talk about American Horror Story later on,
I've
too.
never
Yeah,
I've never
here we
watched
go.
American Horror Story, so everybody's gonna fill me in.
Asylum was a good fucking season.
Yeah, it
was. But she was a housewife who was initially brought in by her husband, who's like, look, she tried to put the baby in the microwave or something. I don't know.
Shit.
I don't remember if she tried to kill the baby. I don't remember if she was just miserable. I would probably be
Wait,
miserable.
didn't that really happen to one of the first lobotomy patients? She tried to strangle her kid, and
I don't know
that's
if
why
she tried to strangle
went-
her kid.
There's something that happened. I can't remember.
But the first person to receive a lobotomy was Sally Ellen Ionesco.
Sally.
She was a
I thought it was
29-year-old.
Alice.
Alice?
So I'm wrong.
Well, no, she got she was the first person to get a regular lobotomy in the United States.
Oh, okay. Got
that
it.
was
Okay.
Alice, someone or other from maybe Kansas.
Oh, poor Kansas.
Yeah. But Sally Ellen Ionesco, she was a 29-year-old housewife with severe depression.
Aw.
And I was not able to find any info on whether or not the procedure gave her actual relief from her depression. But she did live until at least 2004.
Oh, wow.
There was a couple of profiles and interviews with people on StoryCorps who had all kind of not necessarily received lobotomies in every case, but had kind of orbited Freeman and witnessed procedures and talked about how horrified they were at the time.
They assumed that it worked on everybody. When they woke up and they were like, yeah, I feel great. Well, that's because you don't know what the fuck just happened in your brain.
Yeah,
And
right.
you're not realizing that when you start trying to walk, you probably can't walk right anymore because you don't remember how to. That's the issue. They would wake up and they would be like, yeah, I don't have the hallucinations. But hold on, I don't remember why I feel like I have to pee and how to pee. You know what I mean? They just
just
didn't
messes you
know.
up. It just
Yeah, they
messes you
didn't
up.
know. They knew they had to do something, but they didn't know how to do it.
Yes.
That's terrifying.
Truly.
Truly terrifying.
Yeah.
There were multiple reasons to either be lobotomized. There were multiple reasons to get a lobotomy or to give a lobotomy, but mostly it was supposed to cure things that did not respond to other treatments, such as OCD, bipolar disorder, schizophrenia, personality disorders, insomnia, depression, anxiety, epilepsy. Like,
Talking back to your husband.
We're always coming back to the epilepsy.
And apparently
man.
gay people.
Yeah, gay people and talking back to your husband.
Various things. But like everything was posited as a cure for fucking epilepsy.
Yeah,
like,
seriously.
People would probably bathe in the blood of like infants to cure epilepsy, like because it fucking sucks, man.
Yeah, that does. That sounds horrible.
Yeah,
I pity those people so bad. That's
if
rough.
you want to go into another sidebar, I collect epilepsy in media. You remember fucking Hodor in Game of Thrones, where he had the seizure and died? That one fucked CJ up, man. That was fucked up when CJ saw it. But there was another one, and I haven't made CJ watch it because Hodor fucked him up, but there was, I love The Pale Blue Eye. If you haven't seen, it's on Netflix if you haven't seen it, but like the main villain of the story is epilepsy.
Oh my gosh.
It's all like this like, using witchcraft to try and cure epilepsy, and I'm like, you know what? That's fair.
Yeah.
Anything. I mean, I feel like they were desperate. Like these people were fucking desperate.
Very.
Oh yeah, and like getting CJ's epilepsy doesn't even live in his frontal lobe, so like I'm sure there were people who were given lobotomies for epilepsy, and that just made everything worse.
Probably. Yeah.
It wouldn't even touch it because CJ's got the temporal lobe kind, which is like the kind that the serial killers get. But like, it's fine.
CJ, the serial killer.
I shouldn't even say that. That's like so awful to say. I'm sure there are so many.
Such a strong opinion.
Yeah,
from
like
you, Hannah.
99.9% of people who have temporal lobe epilepsy are like normal.
Yeah.
And not serial killers. You know.
Hannah just makes unhinged comments.
I just need to stop. I'm so sorry.
No, you don't.
Continue.
Continue.
I'm gonna skip that. Okay, we're getting back to Freeman and Monique's. Freeman was super convinced in his own mind that lobotomies were helping people, and he was the one who would be able to pioneer this and do it. So I'm sure he did think he was helping people, his motives were entirely self-serving.
Yeah, you're right.
And he was a doctor, but he was not formally trained as a surgeon in any capacity. He couldn't operate on he couldn't take a wart off your fucking foot. And now
my God.
And now he's sticking shit in brains. It's just wild. And he wouldn't wear gloves. He wouldn't wear a mask. So the man is just raw dogging surgery here. And none of this stopped him from developing the transorbital lobotomy. And he was determined that the answer to mental illness was to perform as many transorbital lobotomies as possible. He imagined that this would have the same result. At the end of the day, he thought it would have the same result as a regular lobotomy. But the main purpose of developing this as a different procedure was that more people could do it with less money, with less equipment, with less space.
Yeah. He wanted like psychiatrists to start doing it. He's like, give them an hour. They'll be able to do it.
Yeah.
Like, what the fuck?
Oh my God, dude, no. But there was like a sick element of practicality in this because of mental institutions of the time being what they were, and so overcrowded and so underfunded that they would really be lacking the equipment to provide the neurosurgery that some people legitimately needed. I completely lost my place in this because I just started going off.
Oh, his name's James Watts.
Yes.
I called him John.
That's okay.
I was looking too much into gray matter and white matter and shit like that to pay attention to names, apparently, this podcast.
Yeah, he was, James Watts was initially Freeman's partner who was so grossed out by the transorbital lobotomy that he was like, dude, bye, I can't do
Yeah.
this.
But originally, like, he was, like, super stoked to, like, be working together. Like, they had, like, a good professional relationship. And then Freeman just wanted to go balls to the wall and do what he wanted to do.
Yeah,
and Watts was like, I just had the cold. Why did I come back to freaking ice pick sticking out of this guy's head. You know, like,
Surprise.
that guy was like, and you know what? Fuck you, Freeman. And he, like, shunned him for the rest of his professional career, which is good for him.
And meanwhile, Freeman is over here like, oh no, this is great. I'm very smart guy.
I am very smart guy.
the two main, I guess, pros of a transorbital lobotomy would be that you don't need to anesthetize a person. And they would do this by giving them an electroshock before the procedure and inducing a seizure, after which the person would then be unconscious. Which, like, screaming, fully screaming.
Terrible idea.
Makes me want to fucking
sick.
throw up,
Terrible
man.
Yeah, that makes me sick.
Throw up. So it could be performed at psychiatric hospitals. They would already have the equipment. You would be able to train in like an hour, learn to do the surgery, and just fucking go. However, this kind of led to a lot of other unqualified people performing this procedure in a lot of unsanitary places. It wasn't taken as seriously as it should have been, and due to that,
I'm sorry, I'm laughing at all the A's on the paper.
Oh yeah,
I keep cutting you off. I'm sorry.
That's okay. Anytime there's a bunch of lowercase A's on this paper, it's because I was sitting there just going, ah.
That's exactly how I read it.
Yeah, you should. A transorbital lobotomy was initially seen as something that would have a relatively immediate effect. It was inexpensive and effective and could be done on a lot of people to help them. This sounds impressive, but you know how Jordan said that Moniz was nominated for a Nobel Prize for the lobotomy?
Mm-hmm.
Fucking Freeman nominated him.
Yeah, no shit.
Of
I
course.
looked up to that guy. Like,
Yeah. He's like, oh yeah, let's start chopping brains. It's great.
It's crazy because, like, if you think about it, just a little sidebar, like, Dahmer basically did his own lobotomies, if you really think about it.
You know, I was
the
thinking
beginning
about that.
of it.
Yeah.
Because he used to put, like, hydrochloric acid into holes in people's skull. Like, he would dump it in there to try to lobotomize them and get them to do what he wanted them at his will.
Yeah,
to
right.
make them
Yeah, like,
docile
yeah.
and-
And that's a crazy way of thinking about shit. Dahmer was in a league of his own. He was wild.
It's all bad.
It's really bad.
It's all bad, you guys. But I mean, I guess you could also kind of see a parallel between lobotomy, obviously not the way that Freeman did it, but in general, like, kind of like laparoscopy.
Yeah.
Where it's minimally invasive. You just go in through an itty bitty little hole, you do what you need to do. But with a laparoscopic surgery, obviously people are wearing gloves.
Obviously.
Basic sanitation is observed. You have probably like a third hole where you put a little camera in there. I feel like that's the reason it works, because you get the itty bitty little camera. So you can see what you're doing.
Yeah, exactly.
And you're not just like severing shit. Minimally invasive, my ass. That's a different page.
I had to put numbers on mine because I was getting all fucked up last
that was
podcast.
smart. I did not do that. Freeman took his show on the road. He started traveling to mental institutions to spread awareness and technique. While it is popularly stated that his mobile lobotomy van was called Lobotomobile.
I thought that was wild. I'm like the Batmobile, but with a lot of crazy
serious?
instruments.
No,
in it.
I mean, I am serious that people say that, but he didn't call it that. That wasn't like.
Oh, I'm sure he
that was
loved it,
not
though.
I heard him say it in like a podcast, and I was like, "Yo, the Lobotomobile is so crazy! Like, that's wild."
So basically, like a traveling circus, he goes on the road, shows other people how to do this.
Yeah, and just destroys lives.
And I imagine it as like, you know, one of those like people that the like healer people that like they have like a little pop up and they're like, come see
Like
a
a
miracle.
snake oil
you know, just
salespeople.
Yeah.
just like that. That's what I imagine.
Yep. However, he did perform his own ice pick lobotomy on about 2,500 people, spread out over 23 United States. Some of these people were as young as 4 years old.
Oh my God.
Which that has a lot of A's after
Oh,
that.
Howard.
Yeah.
Yeah.
I listened to something about him.
One man called Howard Dully was one such young lobotomy patient, receiving the procedure at the age of only 12. His family chose to have this operation done to him after his parents' divorce, when he became, like, he started to act out
As kids do.
I
at a
heard
time
his
like that.
I heard his stepmommy was like, "This kid, something's wrong with your kid."
Yeah, she
and,
didn't fucking like him.
Yeah, and like dropped him off and was like, "Yeah, so you're the only one that'll do these lobotomies right now. Will you give him a lobotomy?" Like a fucking psychopath. Like,
Shout out to abuse and neglect, everybody.
Yep.
And fortunately, Dully did survive the procedure, but he grew to be an adult. He lived his life, but he's still alive today. But he has always felt that there was something missing from him.
Piece of his brain?
Yeah,
well,
that's so,
other than
that's
that.
so sad.
Like,
It's terrible.
other than
It's
the
so
obvious.
sad.
It is. It's tragic. It's very sad for him. And he was called to like undertake this personal journey to find out essentially what had happened to him. And he went on this years-long odyssey to uncover as much information about lobotomies, and not only his lobotomy, but other people who had received them and suffered. And he interviewed a lot of other patients. He interviewed doctors, and he even interviewed like some of Freeman's family. Like there are photos that exist of him with.
It's
very it's
that's
great.
Yeah,
That's
like,
very
it's
brave of
crazy
him.
to think that this wasn't even that long
No,
ago.
not
like
that
you know
long
what I
ago.
mean? Like this is like science has come such a long way in like how many years since this? Like I don't know.
Leaps
That's
and bounds.
yeah, that just makes my mind go into a million different places.
Imaging technology is truly a gift. Howard Dully, if you're interested, and even if you're not interested, you should go buy his book. He has a book called My Lobotomy. I bought it. I didn't get into it yet, but I have it.
Oh, wow.
It's probably
you
so
gotta let us
good.
know how it is.
Yeah. it's
Yeah,
probably so good.
I'll read it and report back. I'm sure it's gonna like fucking destroy me.
I would probably shed a tear. I would probably shed a tear.
I completely forgot. I wrote it in my notes. I was like, yes, I will be destroyed forever after I read this book.
Probably.
So, despite his own confidence in this procedure, despite Freeman's confidence in this procedure, we're switching back to Freeman here, many other medical professionals were shocked and horrified by like the sheer brutality of the transorbital lobotomy, during which the patient got Phineas gauged on purpose.
Yeah, seriously though. Like surgeons were at these pop-up shows to see what he was about, and some of these surgeons who have seen guts and gore and everything like that left because they were getting physically sick.
Nauseated, yeah.
Well, yeah.
Because they were just so appalled that he was even doing that shit to a person.
It's insane. I was able to, I found a couple of interviews with various people who had witnessed lobotomies. The first person I found was a woman called Helen Culmer. She was a nurse at Lake and State Hospital, which was an all-black mental institution. And she actually held the head of a patient who was given a transorbital lobotomy by Dr. Freeman.
What the fuck?
Right?
Wow.
Like, that's a fucking experience, man. Like, it burned into my brain till the day I die. But she recalls that there were multiple patients that day. Freeman would routinely operate on multiple patients. He would just, like, assembly line them. He would not leave the room. He would just stand there and people would be brought into him. And he would be like, all right, here we go. And just, bye.
Yeah.
Crazy.
Crazy.
And Helen recalls that at least one patient died during, the surgeries that she witnessed due to cerebral hemorrhaging. Because you're not looking in there. You can't control what you're doing.
Because he's not a surgeon. Normally a surgeon that would have somebody opened up, not to cut you off, but they would be able, if one of the arteries started bleeding, they would be able to snip that artery and control the bleeding, clear it to go somewhere else. He just didn't. He was just like, here, you can go home, and then they would die of internal bleeding.
He's basically in there blind.
Yeah.
All that's in there is the ice pick. He can't see what it's doing. He
Yep.
can feel what's scraping up against the ice pick, but can't see anything.
He's shit. He's just shit.
Helen Culmer recalls watching him take the ice pick, and once it's in there, he just kind of takes it by the handle and just pulls it out. Other side.
Those are good sound effects.
Yeah.
Thank you.
It's exactly how I think it would sound.
Right.
Just ripping sounds.
Yep.
She characterized the procedure as cruel and not at all what she had expected from a surgery. Another witness of lobotomy is Wolfhard Baumgartel.
That is a dope name. That is a
is.
cool name.
Truly. He is now 82, but when he was a young doctor, he witnessed a lobotomy session, like not even a surgery, but like a session where there were 15 to 20 people brought in succession and lobotomized.
Holy shit. That's crazy.
Yeah.
Yeah, Freeman didn't leave the room the entire time. People were just brought to him, and Baumgartel was shocked that somebody could be so relaxed while essentially stabbing blindly around in the human brain. But as a young doctor with no psychological or surgical experience and able to speak very little English, he was not exactly empowered to speak up for...
Which is unfortunate.
It is,
Yeah.
truly. I'm sure a lot of people felt similarly.
Yeah, absolutely.
Widespread horror over the lobotomy began to develop as more procedures were performed and more folks got fucked up. Around 14% of 2,500 people, so about 350 people lobotomized by Dr. Freeman, just didn't come back right. They were just messed up after that.
Yeah, I mean, I'm surprised the number's not bigger.
Same.
Yeah, and like it's miraculous that this did not just outright kill people.
Yeah.
Heck yeah.
One of the most well-known people to receive a lobotomy was Rose Kennedy of, like, the American Kennedy dynasty.
The
Wow.
royal family. I love that you said that. That's a
It's
great
like
way of
essentially-
saying
yeah, there
it.
is essentially
American royalty. That is. I never thought of them like. They are. They're like the most popular family in fucking American history.
Yeah,
so
seriously.
like calling them royalty makes perfect fucking sense.
It's the parallel can be drawn. But Rose, she was known to have an intellectual disability, and like while learning was difficult for her, she was still bright, she was still loving, and still worthwhile as a human being. And as her siblings aged alongside her and were permitted to enter into society, Rose was frustrated that she was treated differently and she was not able to step out in the way that her siblings were, and so frustrated she started acting out, she started sneaking out, and her family started to like wonder what they were going to do about her as like, you know, a problem to be solved rather than a person.
Uh-huh.
Rather than give a fuck.
Rather than give
Yeah.
a fuck.
Seriously, they were just like, let's lock her away.
And well, initially they thought maybe this will help her. As I'm sure like a lot of people, maybe not Howard Delady's stepmother, but a lot of people I'm sure brought their loved ones in thinking
Heck
like
yeah.
maybe this will help
That's
them,
true.
you know?
Do you know why she, like, what kind of disability she had?
Diagnostics were not
Yeah,
then what
clearly.
they are now, but she presented with some delays in learning and speaking
Yeah.
and walking.
Gotcha.
She was
I mean,
just
that
a
would have
little
been
bit
me.
different. She was just a little bit different.
Yeah, I have auditory processing disorder, and look at me. I think I'm doing okay.
Yeah, you're doing great.
They would have been like, lobotomy. My parents were like, to the asylum.
It's all.
But
of
I
us,
heard
man.
that, I
They'd
heard
have
in
gotten
like
all of us.
one podcast, I don't know how true this is, just a little side note, that the doctor wasn't there when whatever their mom's name was in, like, going into labor, and basically the nurse was like, hold the kid in there.
Oh my god.
Hold her in. So basically, like, this baby's going down this canal stuck at the end,
Yeah.
and literally is like, by human nature, supposed to start breathing. So like, was
Right.
oxygen deprived? I heard that as like a I don't know, a quick little tangent in a podcast. I don't know how true that is, but
Yeah,
I thought
I
that was
don't
pretty
know.
interesting.
It's
For 2 hours, by the way, held the kid in there for 2 hours.
That is a long fucking time.
Yeah, so maybe that could be a reason.
It could be like an oxygen deprivation thing. It could
It's just
it could
sad.
be a whole host of things.
Yeah.
There's a lot of things. Humanity is a vast tapestry of many different
Of what ifs. There's
Yeah.
always
and
what
also
ifs.
that. Always the what ifs. But regardless, we're never going to know what was
Yeah.
in the hearts of Rose Kennedy's parents when they brought her in to have a lobotomy. Whether they hope to give her peace or just shut her up. But regardless, Rose did not wake up from her lobotomy the same way that she was before her lobotomy. She could no longer walk, she could no longer eat or speak, and spent the rest of her life abandoned in an institution until her siblings, started showing up for her.
Wow.
It's sad.
Yeah, that's
fucking
super sad.
Yeah.
Because she was young. She was like, what, 20 something?
Yeah, she was in her 20s, maybe like.
That's sad.
Mm-hmm.
Those are like the best. The 20s are supposed to be like the best years of your fucking life. And no, my parents got me lobotomized, and now
Now I'm a vegetable.
Now my brain and my like processes are all like, I'm 2 years
Shit's
old.
fucked up.
Yeah.
Shit's fucked up. But
That's so sad.
Yeah, it was Russian roulette with a nice pick in your brain. And I think what happened to Rose Kennedy was a major, it was a signal of the beginning of the end for the transorbital lobotomy.
Which, like, that's like a blessing
Yeah.
in disguise. Unfortunately, what happened to her, but then kind of helped stop this bullshit.
People really started to realize, like, the human cost of all of it. The last lobotomy... What? No? Okay. I thought you were like... You gotta stop, hey?
No.
The last lobotomy was performed in February 1967, which, like, I don't know, I think my parents were born in 62 and 63. So that's, like, within the lifetime.
My mom wasn't even born yet. My dad was
Yeah.
born 65, mom 68.
If
Yeah,
you
my
got,
mom was
like-
born 63.
Yeah, if you got young parents, or, reasonably young parents, like, lobotomies in their lifetimes.
That's wild. That's crazy.
It was performed by Freeman on a woman called Helen Mortensen.
This is sad.
It is. It's very sad. She was a repeat patient. Apparently, relapses of people treated with lobotomies were common. And Helen was on her 3rd lobotomy.
Ah.
That's so many lobotomies. Yeah, see, I put an
Oh, you
in
won't
there.
like.
Yeah, see, that's
Wow.
how
What other
you-
reaction do you have to that?
She begged him to do that lobotomy too, which
She
is even
did.
sadder. Is that
Yes.
she begged
She-
him because
it
she
was-
wanted help that bad. That's
There's
fucked.
people who were just wanted some relief. She, unfortunately, this 3rd time, Helen suffered a cerebral hemorrhage and bled to death internally. Around 100 other patients had also been killed in this manner, and finally, Freeman was banned from performing these surgeries and any other surgeries ever again, because he had no actual training to fucking perform.
Yeah, fuck that guy.
Freeman gracefully retired at the age of 57. He was known to be a really weird fucking dude who would go around in a goatee, a narrow-brimmed hat, and carrying a cane. He thought he was somebody.
Sounds a little Godfather-esque,
Right?
if you ask
It's
me.
like, ew, sick. Big ick.
You're not cool.
Lots of his writing exists, but it was mostly research, so we don't really know if he felt like any type of way about it, if he felt any remorse
Probably not.
for the horrors.
I just think unfortunately,
He
I think he genuinely thought he was going to help, like he was helping people.
Yeah.
He believed his own
And,
hype
like,
to the end.
It's like like you said, he fucking drank the Kool-Aid and lost his ever-loving fucking mind in his own mind. Like he should have been lobotomized. He should have shoved those goddamn ice picks
Honestly.
up his face.
Let's see how you like it.
Yeah, like maybe he needed it because he was so obsessed
Yes.
with being right.
Class A sickie.
Class A sicky.
But he died in 1972 following complications after a cancer surgery, and the world was shot of him forever.
Good riddance.
Yes.
Yeah, that may have been a karma thing, buddy. Sorry.
Yeah. Died on the
Should have got worse.
I don't know if he died on it. Yeah, it could have always been
I think it was
worse.
colon cancer too, so maybe he just shitted it himself.
Shitting your pants to death.
Well, he spent a lot of his time at Trans-Allegheny Lunatic Asylum, and I'm going to get into that, but we're going to take a quick break, and we'll be right back.
If you're loving the Ghost Encounters podcast, be sure to hit subscribe and drop us a 5-star rating. Stay connected with us on Facebook, Instagram, TikTok, and YouTube at Ghost Encounters PA. For haunted merch, head over to ghost-encounters.com and check out the spooky shop for all our exclusive items. Want to unlock the full Ghost Encounters experience? Become a spooky VIP on Patreon. With your membership, you'll get ad-free episodes, early access, discounts on exclusive merch, and bonus content that brings you closer to the mysteries and the macabre that we explore. Ready to join our haunted community and jump into the shadows? Visit patreon.com/Ghost Encounters Podcast and take your place among the VIPs of the paranormal.
Here's a hauntingly good drink to pair while you listen to Ghost Encounters podcast. It's mead from Colony Meadery, right here in the Lehigh Valley. Mead is alcohol made from honey, and Colony Meadery crafts one-of-a-kind meads from bold and flavorful to award-winning classics. Whether you like sweet, tart, zesty, or refreshing, they have a flavor to match anyone's taste. Discover your new favorite spirit at colonymeadery.com. Looking for a marketing company that's hauntingly effective? Well, Ghost Marketing Company provides expert white label marketing for your business. They bring your brand to life with social media management, eye-catching graphics, targeted ad campaigns, and stunning photography and video production. With Ghost Marketing, you get all the benefits of a marketing team without big agency pricing. It's so good, it's scary. Are you ready to grow your business? Visit ghostmarketingco.com. That's ghostmarketingco.com. And we are back again. Let's get into Trans-Allegheny Lunatic Asylum, which is located in West Virginia. It's a monumental building whose history is as dark as its Gothic revival architecture. It was constructed around 1858 and 1881, right around Civil War era time. But during the Civil War, this building was actually partially constructed and was taken over by Union forces, and it became a military post known as Camp Tyler, housing troops and supplies. The turmoil of the war left its mark on the land and likely contributes to the asylum's haunted reputation. When the war ended, many soldiers were admitted to the hospital. They were put in a wing that was called the Civil War Wing. Most of them ended up dying in the hospital, cursed to haunt the halls forever. People hear phantom footsteps, disembodied commands, like war commands, and spectral figures in military uniform have been reported seeing wandering the halls. So already, this building that's not even finished gets a haunted reputation.
Wow.
And is surrounded by death. Now, the building was originally designed to house about 250 patients.
Oh, here we go.
And it emphasized
Couple thousand.
emphasized the Kirkbride plan. Now, what the hell is a Kirkbride plan?
Oh my God! I think I know what this is because
So-
of the last one.
Yeah, so
Fuck.
this is what most of the asylums tried to
talked about
adhere
this
to.
before?
I think so.
I think we mentioned it. We didn't really get into it.
Mm-hmm.
Basically, it's a
I must have been
19th.
too depressed.
Yes.
Sorry, my bad.
Basically, it's a 19th century approach to mental health care and architecture. It was designed by Thomas Story Kirkbride, hence the name. It was supposed to have asylums be a curative environment where mental health patients could recover through light air and therapeutic designs. Buildings under this plan had sprawling wings that allowed for sunlight and ventilation in every room. And the Trans-Allegheny Asylum is the largest hand-cut stone masonry building in North America, embodying this architectural idea. Now, as we know,
Didn't really go that way.
it did not go that way. These places were not therapeutic. These places did not help. I mean, they were designed to be that way. However, as we know, the intent of providing this restorative care fell apart as overcrowding just ensued all of these buildings. And we're not just talking about this place. We're talking about pretty much every single asylum, not just in America, but around the globe is what this happened to.
Yeah.
Terrible overcrowding. The focus shifted from healing to containment, especially as social views of mental illness deteriorated. It officially operated as it was supposed to in 1864 under the name Weston State Hospital, and the asylum's population soared to nearly 2,400 patients by 1950s.
Oh my goodness. That's crowded.
At a place that was supposed to have 240 patients.
That's like people sleeping in hallways.
Yeah.
Yeah, and if you look up pictures of asylum, like, that's what happened. You have huge rooms of just beds and just so much overcrowding. There wasn't enough funding. There wasn't enough nurses or doctors to even give any kind of care to these people.
That's so sad.
yeah.
Truly.
This was basically about 10 times its intended capacity. This was due to people being admitted for conditions that they probably shouldn't have been, like women, like we said, who were not the perfect, housewife. Laziness, reading novels. People were being
Women can't read.
like, it's insane.
That is insane. That's crazy that they even had that fucking
Yeah,
thing.
and the people that were deemed uncontrollable were often subject to inhumane treatments like lobotomies, electric shock therapy, all this stuff.
The insulin thing.
A lot of things. And the facility actually did not shut down until 1994.
That's when I was born.
I was born in 92.
Same.
So when we say, like, obviously the lobotomies stopped, but these awful places existed for a very long time in our lifetime,
That's crazy.
right?
And I'm sure there were people that Freeman trained who were like, nah, this is great. I'm doing
Like,
it."
yeah, like,
You know?
let's totally
I don't
keep
know.
this up. Yeah,
Yeah.
you don't know.
Right.
You don't know what kind of
that's true.
protege he
That's
had.
true.
Yeah.
Because the patients that were there were treated very inhumanely. So I'm sure there's a lot of undocumented things that happened. I mean, there's some asylums that have their own graveyard. Just
Arguably
unmarked
a lot
graves.
of them, yeah.
Yeah.
Now, here's where Freeman comes in. As we know, the godfather of the ice pick lobotomy.
He's the fucking lobotomy guy.
He is also tied to the asylum's chilling story.
Oh, really?
Yes,
That's
there is no
cool.
direct number of how many he performed here. However, it is stated that he did do about 10 to 15 per day, and there was 1 week where he hit a record of 228 lobotomies in 1 week
Holy
here
fucking-
at this place.
Wow. I just thought you talked about it because they did lobotomies. I didn't know this fucking guy was
There's a
there.
lot.
Oh yeah, he
What
was
the fuck?
like one of the main doctors here, and he did 228 in 1 week.
That's wild.
Insane.
That's crazy.
Insane. Now, obviously, some of these individuals did not make it or ended up dying there because a lot of people were there for a long time. And a lot of them still haunt the halls these days. Apparitions with vacant expressions and erratic movements, possibly affecting the neurological damage that was caused, have been seen roaming the halls.
That's so
The
sad.
operating rooms and treatment areas are hotspots for paranormal activity, with visitors describing sensations of being watched or suddenly overwhelmed by sorrow.
Oh, same girl.
Now, remember we brought up American Horror Story.
Yes,
Okay, so in the Asylum season, which is season 2,
I think so.
Asylum.
It was good.
The doctor in that season, his name was Dr. Arthur Arden. It said he is based on Dr. Walter Freeman.
I love when
and they
they do that
actually
stuff.
kind of look similar.
Ew.
I can
Really?
kind of
Yes.
see that. The way, like,
So if
James
you-
Cromwell, he's that, like, kind of sharp, the long,
Yeah, and he
sharp
had the little
face.
goatee
Mhm.
thing
I'm
going
looking.
on.
I'm looking it up.
Yeah,
I
yeah,
need
go
to
ahead.
see this.
Look it up.
You know, when I think about Dr. Arthur Arden in particular, my brain starts regurgitating the phrase, "Show me your mossy bank."
Oh, he played him.
He was that guy.
Yes.
He was.
Doesn't he kind of look like
Ew,
him?
yeah.
like
the
the-
warden from The Longest Yard. Sorry,
Yeah,
I always
him
have
too,
to
him
think
too,
of
yep.
him.
He was in The Green Mile.
He
He
was.
was
Let me
in. You remember Babe, the movies about the pig?
Oh, wow.
He did that.
He
That'll
was in a
do,
lot.
pig. That'll do.
But he
Oh,
really,
he's been
but
around.
he was creepy in that season, and he really does look like Walter Freeman a bit. So I
You
can
know,
see the
He
connection,
does.
you know?
Okay, now that I'm looking at like a later in life.
Yeah, I would say a kind of a
Yeah.
later in life version.
That's so weird.
It was a
Yeah.
good casting choice.
It was,
honestly.
it
They
was.
did a good job.
Now, there are some notable spirits here at the Trans-Allegheny Lunatic Asylum. Whether or not they were patients of Walter Freeman, I do not know. But some of the infamous spirits, one of them is known as Lily, a child born in this terrible place to a patient. Lily lived a short, tragic life, succumbing to pneumonia at the age of 9.
Aw.
Visitors claim her spirit lingers in a very special room adorned with toys and gifts, left by those hoping to connect with her. Reports include toys moving on their own and candy mysteriously disappearing.
Did they do something with Lily on a Ghost Hunters episode? Because I think
I'm pretty
there was
sure.
a ball that went rolling.
Yeah, I'm pretty sure.
Yeah.
I don't fuck with the,
Yeah, there's
the
a-
kid ghosts. I don't know.
Well, imagine
Poor Lily, but
us
still.
going into an asylum doing an investigation. There's just a room filled with dolls and toys and all
Nope.
kinds of stuff.
Nope, I can handle Phoebe.
Phoebe.
That's it.
We love you, Phoebe. Don't haunt us.
Phoebe, you're my best friend.
Now, there's also Dean, an inmate at the asylum who met a grisly fate when 2 fellow patients, Big Jim and David Mason, murdered him.
His name was
Oh,
not fucking Big Jim, though.
They call him Big Jim. They call him Big Jim. He was a big dude. I don't
Fuck.
know what his last name was, but they call him Big Jim. They beat Dean to death using a metal bed frame.
Oh my god.
Yeah, it's awful. It's said that Dean's spirit lingers in the asylum, quietly mourning his violent end. Visitors have reported feeling overwhelmed sadness and hearing faint whispers in the room where he was murdered. Though, the energy quickly changes when the shadowy figures of his murderers, Big Jim and David Mason, are sensed nearby.
Oh, so they're there with him?
Yes.
They're all
That's
haunting
like-
the place? That's
Their
bullshit.
presence is marked by bursts of aggression and oppressive energy, especially around male visitors.
You can't even fucking get away from Big Jim and death.
Nope.
I wish
Sorry,
I was
Big
ballsy
Jim.
enough to go into like Trans-Allegheny and be like, "Fuck you, Big Jim!" Like,
Just beat your
I wish
chest
I was
Big
ballsy
Jim.
enough to
No.
step up. I would be manhandled by the ghost.
That would be it for me, man.
I would be dead.
Yeah. Now there's also Ruth, who was a former patient who despised men.
Well,
Her aggression during her lifetime seems to have carried over into the afterlife. She's known for throwing objects and creating discomfort for male guests. Ruth's spirit is said to patrol the areas of the asylum, making her disdain for men very, very evident. Her story likely reflects the anguish and trauma that women endured during this time. She probably hates men so much for probably what she was probably one of Walter's patients, and she was probably thrown in there just because she wasn't a perfect housewife or she was reading.
Probably,
too
yeah.
many novels.
You know?
Some bullshit
Yeah.
reason, yeah.
And yeah, so of course I'd be pissed too,
Fuck yeah.
right?
Girl, same.
Now this next one's funny. No one knows what his real name is. There's obviously records are very lost, but there's one called Slewfoot.
Slewfoot.
He's one of the darker entities rumored to haunt the asylum. His nickname is as ominous as his reputation. Historical records about his life are very sparse, but legend has it that he was a very sadistic figure who enjoyed tormenting others, both patients and staff. Supposedly he roamed the upper floors and killed and tortured people in the upstairs bathroom, and that's where his spirit now lingers.
That is
And
not where I thought that was going.
People feel cold gusts, and they have heard guttural growls and experienced sudden dizziness
It's crazy that
in the
there
upstairs
was
bathroom.
murderers there. Like, these people were like, okay, I'm
Oh,
here,
yeah.
you make me stay here, so now I'm gonna start killing
Well,
people.
you remember the one asylum? I'm not going to say the phrase that gets us every time.
Ugh.
You
might as well say it.
No, I'm not going to say it.
People are asking.
Oh,
Nope.
okay. I remember the code phrase.
Wait, what's the code phrase? Why don't I remember it? I was on the episode.
Cocks up.
Oh,
Yeah.
I do. Okay, I
Yeah.
remember that one.
All
The
right.
guy who chopped his dick off 3 times.
I
That's
think
right.
that's when my dad was like, "Y'all are messed up." Like
Well,
when he
it
heard
really
that
did happen.
shit.
It was an asylum, and it was an asylum where they also brought in very violent criminals. They had a separate wing for it, J Ward, and they had very sadistic, violent criminals. So obviously, in some asylums, they didn't have a separate, ward for them. I mean, usually they had a separate ward for like the ones that are more violent to keep them separated from the others. But obviously, mingle and mesh and overcrowding, it's hard to keep track of.
After
You
a
know what I
point,
mean?
there's nothing you can fucking do. There's nothing anybody can fucking
Yeah.
do. There's just way too many fucking people.
The horrors experienced within these walls left a very tangible mark, fostering one of the most haunted places in the United States. It's up there.
Yeah.
Well,
Yeah.
no shit. Makes perfect sense. Why?
Seriously.
All of the trauma.
All of the trauma. All right, I need to zen for a moment. We're going to take a very quick break, and we'll be right back. And we are back. This has been
Mixed.
A lot.
a wild episode. I think I may have lost my mind a little bit hearing
Yeah.
about all this. I mean, thanks to you, Jordan, we really know how a lobotomy works. Multiple
tried.
different kinds of lobotomies. Thank you, Hannah, for your insights
Yes.
on the father of the ice pick lobotomy.
Yes, you did fantastic, y'all.
And
All
thank
of
you,
ya.
Justin, for
Telling me
that-
about the spooky place.
yeah, top tier spooky shit.
Well, that is my specialty.
Yes.
So,
the spooky boy over here.
yeah. Thank you all so much for listening. Hope we didn't disturb you too much. And
We
it's-
could have made it much worse.
I mean, we have a show and tell. We literally have a diagram and an actual lobotomy pic depicting what it looks like, how big it is, and how far it goes into someone's head.
This one was never used on anybody though. Like this is just for funsies.
Thanks for letting us
For
know.
funsies. Well, okay.
Appreciate to know that there's no brain matter
Yeah, no,
on
I
that
mean-
motherfucker over there.
You can wash stuff.
Oh my god.
You can.
You're not wrong. You're
Yeah.
not wrong.
I'll never forget. I was in California. I was visiting Sophie. Hi, Sophie. And we went to a kind of like a horror museum.
That sounds like
And
fun.
they had a shop area where, of course, they had stuff for their place, but they also had a lot of actual things. I'm gonna say there were cases filled with like old medical equipment and instruments, and you could actually buy this stuff.
What?
And I did ask the guy. I said, "Do you have any lobotomy pics?" I was asking for you.
Yeah.
And his exact response was, "As soon as we have them, they get sold out."
Yeah.
I mean,
Great.
this is like researching and looking up lobotomies. Like, I never cared for them until I actually started reading about them. I was like, this is so intense. This is so
medieval,
crazy.
man. It's fucking medieval.
It's
Very.
like, this is like torture in modern age.
Trepanation.
Like, this is the type of shit you would have thought was like horses and castles and people fucking with their weird torture devices.
Yeah,
but this is
seriously.
like modern century shit, which is wild. So it was easy for me to do a deep dive. And like I said, I could have done way more damage, but I tried to keep it easy.
It could have been
Quick.
even grosser.
Could have been worse.
It could have been. I will not put any visuals that were going to stir people up on the video part of this.
I mean, we've already got this here. So.
I mean, you already got that there. Yeah.
we're good.
If they want to look up other things on their own, they can.
Yes.
I'm not going to force people to look at.
I looked at this one link that I have in our notes, and I sent a couple pictures to Justin, and I was just like, wow.
The one that sticks with me that she sent was the skull of a person who had one of these ice pick lobotomies, and obviously it looks like a regular skull, but right above, like right center and up a little bit where the eye sockets are, the empty bone eye sockets. There's just one hole on each side,
Yep.
right here,
Yep.
right where the ice pick went
They
in.
go
So I guess
in
they
there
didn't make it then. If that didn't, because that would heal up.
unless
Right.
they got it done. I don't know. And then
Who knows how long he
Yeah.
died after, if it was
Yeah.
immediate. But yeah, you could see the holes from where
Yeah.
where the central ice pick entered.
Hannah, did I send you that picture? I'll have to show you that.
Maybe. Yeah. I mean,
It's wild.
I could Google it. I'm sure I can find that.
I was like, yo, this shit great.
Even I remember I've seen.
Oh, yep,
some,
there it is. There it is, yep.
Oh man. And they gotta tilt the head back so you
Yeah.
can see.
Yeah.
That's fucking. Where did they get that?
I don't know, but it's preserved nice. They got it on a nice felt
Yeah.
cloth and
The
shit.
teeth are there too and everything.
Yeah, they kept that shit in pristine.
Well, like I said, thank you all so much for listening. Please give us 5 stars wherever you're listening. Share the podcast around. We're so excited and happy that we're on video and people are really enjoying it.
Give us your feedback.
We've got
We
a
wanna
lot
hear
of
your
great
feedback.
Yeah. Talk to us. We're
I have
around.
to do a shout out.
Oh, do we?
actually.
Oh, shit.
yes,
Oh,
we
fuck.
do. Yes, we
Another
do.
shout out? 2 in 1 episode?
We're still small enough that we react to you, interact with you. Let's be friends.
Let's all be friends. Brian, I don't know if you want me to say your last name or not. Brian R. You were the first one to comment
Like instantly?
almost instantly on season 4, episode 1, and so I just want to shout out Real MVP.
Thank you,
Brian
Brian.
Thank
R.
you.
Thank you for listening. Thank you for watching, and thank you for commenting and loving our podcast. He said it's his favorite podcast. He was so stoked
Yes.
that we
You're
were
a
back.
homie.
Yeah. He said, "Oh my God, I'm so happy. My favorite podcast is back."
Yeah,
So,
that was so awesome.
I love that. I love that.
Delightful to see your comment.
Now we do have a spooky fan story. It is from MEV. We have run out of time. We
It's
have
so
gone
fucking
way
long,
over
bro.
time.
It is so
We are
fucking long.
100% saving your story for the next podcast
We did not
episode.
forget about
We did not
you.
forget
No,
about
we
you. We just have
see
been
you.
running over a little bit in time, but we for sure have your story. We're going to read it next time 100%. MEV, shout out to you for sending a story. And that's a reminder for all of you, because after hers, do we even have any more spooky
I don't
fan
know. I
stories?
haven't checked my
Oh my God.
Gmail. I
We gotta
check.
check. We might have one, we might not. But if you have a spooky fan story, send it to us or message us on social. Remember, email GhostEncountersStories@gmail.com. Message us on any of our social platforms. Whatever story it is, no matter how long, how short it is, whatever it is. If it's like even if it's just like a tale that you told around
Or
your
like
town.
a family legend.
Yeah, who knows? Could be anything paranormal, anything a little spooky.
Just get weird
Yeah, we're always getting weird.
forever.
I just cracked my toe so loud. I really hope that did not go onto my mic. That was loud as hell.
It might have.
I was not expecting that. Sorry, guys.
All right, well, shall we?
Shall we? We shall.
That's all the time we have for today. Stay spooky.
Hide your ice picks.
And please wash your hands before you go digging around in my brain.
Oh, sorry, my laugh just popped right out of my chest. Sorry.
It's okay.